Good evening, everybody, and welcome to this evening's Imagine Austin Speaker Series. My name is Kathleen Fox. I'm with the Planning and Zoning Department of the City of Austin, and I'm the project manager of the Imagine Austin Speaker Series. This is our 33rd event in 6 years. Today's event is sponsored by the City of Austin's Office of Sustainability and our department, the Planning and Zoning Department. The Imagine Austin Speaker Series at its core is the opportunity to promote and implement the Imagine Austin Comprehensive Plan, the City of Austin's visioning document for the future through mutual learning and shared dialogue. In the last 6 years that we've invited thought leaders and experts from across the nation to speak on a variety of topics, including, but not exclusive to, land use, mobility, affordability, housing, sustainability, water resources, the built and natural environment, public health, culture, and social equity, which is the theme of this evening's event. Our format tonight is that our featured speaker, Wendy Ellis, will give up to a 1-hour presentation, and after that, we will take questions from the audience. Without further ado, here is Carmen Llanes Pulido from GAVA. Let's give a hand to Carmen. Woo!
Thank you. Good evening. Good evening. Hello, everyone. Thank you so much. For just this moment, I'm going to introduce our fantastic speaker. My name is Carmen Llanes Pulido, and I'm absolutely thrilled to have a thought leader like Wendy Ellis here at the Carver and sharing some of her knowledge and her work with us this evening. For those of you not familiar with Go Austin, Vamos Austin, or GAVA, we are a community-driven health initiative in South and Southeast Austin. This initiative was born about 6 years ago in conversations in Dove Springs. And the initiative was catalyzed by the Michael and Susan Dell Foundation, but it was operationalized by the people and the neighborhoods and the organizers of Southeast Austin. And over the course of these past 5 years, over 30 neighborhood and school-based teams of people who live and work and call these areas home have adopted and stewarded their parks, green spaces, healthy food, retail outlets, neighborhoods, and corner stores to make healthy living more accessible. And this has resulted in community improvements in the built environment and infrastructure that reach up to 90% of the people who live in 787 and 44 and 45 in South and Southeast Austin. We're very proud of that, and we know that none of this success would have been possible without community organizing that leveraged the very real richness and resources of the relationships that exist in these communities. For many of our staff organizers in the GAVA headquarters, some of us grew up in East Austin, not far from here. And we, I think, regularly find a certain familiarity in the richness of the tight-knit communities, both that have existed for a long time in Dove Springs and areas of South Austin and that are coming together. Because we see a lot of what made us resilient in times when public and private forces devalued, undervalued and under-resourced these areas where communities of color have traditionally lived. So I think it's very key as we're talking about this in the George Washington Carver Museum and Library that we acknowledge the history and the culture, the path that got us here, because that is really key to Austin's humanity. As we are a growing city and we accommodate those newly moving here and the changes of our times, what will make us resilient through these changes is understanding where we come from, our culture and our history, and the richness that makes this city what it is. I think across the country, no matter where we look, when we're looking at the environmentally stressed communities, for example, who are disproportionately those of color and those who live downstream, we equally need to pay homage to the history and the culture and the learnings that got us here so that we can find community-based solutions that work, that are specific to the communities that we live and work in, but that affect systems. And I think that's one of the most striking things to me, what makes me excited about this model of building community resilience, is that it focuses on the experience of the family, not just an individual, but the community within which they live, or work, or learn, or worship, or play, and also looks at the systems that impact all of the elements of the environment for that family. So by taking that dual approach, we actually are looking at ways not only to understand how we've come to these now massive inequities, but how we can find solutions that make the quality of life better on the ground and actually influence the systems to address root causes. So I'm so excited to have this intersection of thought because the work that we do in GAVA is very, very hyper-local. The work that the city of Austin is doing is unique from any other city, and yet we have these lessons to learn from across the way and to hear from thought leaders like Wendy Ellis and to learn more about this exciting model. So without further ado, I'm very pleased to introduce Wendy Ellis and give the mic to her to share this model with us. Thank you so much.
Thank you, Carmen. Because I know that there are a number of different places that you could be this evening, but I want to hear from you later on this evening. And for my first display of resilience here, I've been told that while Kathleen said I had up to an hour to speak, I've also been directed that I really only have a half hour, so we'll see what happens at the 30-minute mark here. What I want to help you understand is what we are talking about when we talk about resilience, how we think about community, and what are each of our roles within our specific organizations we work with, but also within our own zip code that we live in building resilience and displaying resilience across our community. So one of the first things that I want to help you understand are what are the many faces of community adversity. So all of us from our particular walk of life have a particular means of orienting ourselves around adversity. Here in Austin, certainly earlier this year, we understood adversity that was brought on by the trauma with regard to these series of bombings that were occurring. So there were certain neighborhoods and certain individuals within neighborhoods that were being traumatized by this, what felt like it was very random acts of violence. So for those of us that work in the resilience work, we would recognize that as something that was an acute shock that was happening at the community level. But then also we have in this environment, particularly in Texas, being a border state, we have the traumas that are brought on by our immigration reform that are going on. So understanding that there are traumas that are associated with the loss of place, those individuals that may be fleeing particular political regimes or seeking some other opportunities in our country, and how we are handling that level of immigration. And unfortunately, traumatizing some of the younger individuals that are involved in that. But this is also going on in the context of long-term chronic adversity that has been here deeply rooted within Austin for those that have been living in this community for a long time. So what I'm talking about is something that is very familiar to all of you when you think about the east-west divide of Austin. Thinking about the opportunity for economic mobility from the east to the west side of I-35. And it's pretty, I'm sure that I don't have to beat this point in, but understanding how we got here to this outcome is really critical to us to understand when we talk about systems design. Because what you'll see by the end of this talk is that this is absolutely by design. This is not necessarily something that happens randomly. So I'm going to take you through the first 242 years of history in about 30 seconds, so strap in. So here we go. We're starting with the Constitution era, and with our country understanding that we are within our articles of declaration as a country, we had set in there a system of inequality because we reaffirmed a slavery there. So we reaffirmed in our Declaration of Independence that independence really only meant for some. And that has been systematically repeated throughout our course of history when you look at the significant U.S. social and criminal policies over time. And that there's also been this pattern of swinging from the left to the right. And currently we have swung very hard to the right. And so you see that over time, as you know, we went from the Reconstruction era after the Civil War to the 13th, 14th, 15th Amendments that provided lots of rights to individuals, the abolishment of slavery, but with the abolishment of slavery in the 13th Amendment was also the establishment of slavery if a person was incarcerated. So keep that in mind when you think about our rates of incarceration in our country, and also how we've stripped citizenship to a certain extent from those individuals that are involved in the criminal justice system. So we've always had this separate and unequal setting in our country, and that was reaffirmed by our Supreme Courts in the post-Reconstruction era with the Plessy versus Ferguson ruling that said that by law, but as long as we were providing separate and equal facilities, that segregation was okay. And that was also during the same time that we began to have the rise of the Jim Crow era. So what's really important, particularly for Austin with regard to what happened in the New Deal era, were the New Deal housing initiatives. So right here where we sit, Rosewood Courts, Chalmers Courts, Santa Rita Courts, those were the first public housing developments in the entire country. In 1923, City of Austin got the first grants from the Housing and Urban Development Department and built the first public housing units. What's important for us to remember is why were there 3 distinct settlements that were put together? Because the government said, our government went in and had adopted rules around neighborhood composition. And so the federal government would grant land and grant money to develop these housing developments as long as the developer and the builders would recognize the current neighborhood composition, which meant that you could not segregate or integrate a neighborhood that was already segregated. So there you got Chalmers, which was the whites-only development. You had Rosewood, which was African American, and Santa Rita, which was primarily for Latinos. And so through the New Deal housing, and even in the post-World War II economic expansion, when we had our federal government involved in the housing and supporting and guaranteeing of mortgages, they had in there that guarantee that in order to have that insured, that it had to be a whites-only development. So that's where the banks began to do the redlining. But it all was baked into the system. So these aren't things that just happened randomly. These were things that were actually supported for our systems. And so this has continued on not just in our housing systems, but also when we think about our criminal justice systems and how we have militarized our police, militarized and fortified our school environments, which has then helped us create this school-to-prison pipeline, where disproportionately you have some individuals that are winding up, particularly individuals of color, that wind up in part of the mass incarceration and prison institution. So these are all these things throughout history, our social policies, that you have to think about. They were absolutely designed for the outcomes that we see. And so what do we see? Here, right here in this zip code, 78702. This is one of the 13th most gentrified zip code in the entire U.S. That's probably no surprise to you all. And of course, you know, on paper it looks great. Look at the increase in value of home values, of household income, of education. Who would argue against having an improvement of education levels? Well, what I would say, is that reflective of the individuals who have been here historically, or does that more reflect those individuals who are coming into the area? And what's happening to those individuals that are getting pushed out? So earlier today, I learned a lot more about what's happening to individuals that are getting pushed out. But I want you to see the rate at which this is happening. So if you look at your census from 1990 to 2000, those areas of the darker color up there in the top one show you where you had gentrification. And then if you look to see where that's happened from 2000 to present, look at how much that's changed. And ask yourself, where are the individuals that are no longer in those areas, where are they going? Well, I heard today from a number of conversations, understanding that those individuals are now getting pushed further out, further east, where there are fewer resources, and you have now this mix of former urban poor with the rural poor. There's still no access to resources, still no access to economic mobility, but this is what's happening to a large proportion of your population. And those that get pushed further out east are also being cut off from the latter to middle class to economic mobility, and also looking at where the concentration of jobs are. So when you look at where individuals are being pushed and where the concentration of affordable housing, which is where the darker areas are, you can begin to see where there's this spatial mismatch there. So then understanding that this is really truly a threat to your community resilience when you don't have an equal level of economic opportunity to those that live here, and also thinking about the workforce. Because when we look at your numbers for as far as who are the children in this area, more than 500,000 of Austin's children are children of color. And so we're talking about your future workforce here. And so when you have individuals that are living in areas of concentrated poverty, that also mean that they're living in areas of under-resourced schools, then what are you really doing to invest in your future workforce? So when we think about housing as a key determinant for stability, one of the areas, particularly in those areas that are facing gentrification, we look at what is your rate of expiration for affordable housing. So this is a chart that we use in a lot of the cities that we go in to look at the low-income housing, tax credit housing, and what is the rate of expiration. So not just looking at what's available today, but looking at the rate at which this will expire over time. And what we're seeing here that's happened from 2011 to 2014 is that you had nearly 3,500 units of affordable housing that you lost in just 3 years. And I don't remember the statistic, but that's more than what are coming, a number of individuals that are coming into the Austin area on a regular basis. So you have this mismatch of who's coming in, who's getting pushed out, and what's available for the middle class or affordable in your city. So again, this is a major threat to the city's overall economic mobility and resilience. So again, what I'm showing you is how all of these forces kind of interact and create vicious cycles, but that's not to mean that we can't create virtuous cycles. So that we can promote resilience. But understanding what are those levers within each one of these areas that would promote resilience. So really thinking about how we're financing public schools and understanding that dependence and that connection to your housing values and those individuals who actually can afford to live in a community, and how that informs the school population, but also understanding that connection between criminal justice and public schools. So the lower resource schools wind up relying more heavily on school resource officers as opposed to interventionists in the schools to deal with behavioral issues, and those kids are getting cycled more so into criminal justice, literally getting pushed out of a system. So we have to think about all of these forces. If our systems are designed for these outcomes that we get, just as you saw earlier in the timeline, they absolutely are designed for these outcomes, then it also means that we can redesign a system for better outcomes. So understanding why we would care if some people are suffering these outcomes is because literally when we talk about adversity, particularly childhood adversity, we're talking about all of us. We're not just talking about some people. We literally are talking about all of us. By a show of hand, how many of you are familiar with the Adverse Childhood Experiences studies and understanding trauma, childhood trauma? The understanding that in this room, the majority of us have at least one ACE. I don't know anything about your walk of life, your upbringing, where you come from, but I do know that as Americans, that's one thing that we all share in common. ACEs are a public health issue here in this country. And so understanding that this isn't just about those people, but understanding that there are different outcomes for individuals that are exposed to ACEs helps us understand the importance of the community environment. And so when you look at how adversity piles up, poverty, violence, homelessness, it literally gets under the skin. That's what the science of ACEs shows us, is that it literally gets under the skin, and we see these negative health outcomes. Not only that, the latest science is showing an epigenetic impact. So not only is it getting under the skin, it's changing DNA. So when you begin to look from generation to generation in the transmission of chronic disease from generation to generation, you're talking about the effects of cumulative trauma, cumulative adversity. So it is no wonder, again, when you look at certain zip codes and certain family lines that repeat the same cycles, why this is happening. Again, back to that point, our systems are designed for the outcomes that we see. And so in order to re-engineer that and get out of the vicious cycle, we have to think about those virtuous cycles that we absolutely can control. But I want to show you what that looks like, that vicious cycle looks like to a child. Part of the reason why we use the tree analogy in our work is because you'll see how well this fits, even when we're talking about human biology and human development. So for the top picture there, you're looking at normal neuron development of a newborn. So think about a newborn. You know, newborn, bright eyes, they're taking in everything around them, whether that's a mother's touch, whether that's someone that's responsive to their cries, to their needs, to just taking in new colors and new sounds and new feels. That's literally the neurons branching out and saying, what a wonderful world, I want to see it all. But what happens when a child is in an adverse environment where parents are completely stressed, where there may only be one parent, where there may not necessarily be enough food on the table, where there's this constant environment of fight or flight because we don't know what's going to happen from moment to moment. Who wants to be in that? Look at this. You would crouch down, protect yourself. And that's the same exact thing that's happening in the structure, in the brain architecture. You see this stunting of the branching. Because who would want to reach out anyway into that environment? We don't want to be a part of that. And so it's literally like taking shears, pruning shears to the trees. And you see that there's a difference in how the brain architecture begins to be fermented. And that's in early development. So then is it no wonder that we begin to see children who are 2, 3 years old that can't sit still, that can't pay attention, that have anger issues, that have early onset of depression, are withdrawn and things of that nature, because they're not necessarily being programmed in the same way and having the same healthy development as those that are living in positive environments. So this is why it's really important to think about the impact and understanding that resilience isn't just about having grit, but it's also thinking about where are we to derive our strengths? What is our community doing or providing to have a more positive outcome? So that's why we've moved from just talking about ACEs to the pair of ACEs. And why we use the tree as this analogy here, to understand that what we're really talking about are adverse childhood experiences in the context of adverse community environments. And some of this is unfortunately cut off. I had some statistics here to show you what this looks like and what children are suffering from here in Hayes, Williamson, and Travis County to really understand the impact, the regional impact of ACEs. So the national data that we were able to pull shows that more than, it's about 27% of children, so almost a third of children or a quarter of children in this area have 2 or more ACEs. So think about all of these negative exposures, that more than a quarter of the kids in the area here have that 30%, a third of the children are living in areas of concentrated poverty, that a quarter of the children are living with families with financial instability. So when you're thinking about not only what's happening at the surface that we might be able to detect in the classroom, in a community center, in a park, there are other things that we may not necessarily readily be aware of that these kids and their families are dealing with. So the combination of the two, this is where you get to, if some of you are familiar with the term toxic stress. It's the cumulative effect. Not just what's happening to that individual, but what's the context in which these things are occurring. And how do we create a better environment? So that's what the BCR work, Building Community Resilience work, is doing across the country. In 5 different communities, really working across sectors to not only work on program and practice, so thinking about those interventions that we can do at the individual level, but really thinking about the big policy issues. So when we talk about affordable housing, when we talk about the effects of gentrification, when we think about what are those barriers to economic development or access to economic mobility, how are we bringing the right people to the table to get under the hood and really create a new system of operation? So I want to give you an example of what some of the work that's being done across the country. But I think this is a good time to pause and just do a level set here and make sure that we all understand when we talk about resilience what we mean. And so you might say, well, why didn't you start off by that? Because I needed you to understand first, what are we talking about when we're talking about adversity? So what do we need resilience for? And then we'll get to what resilience is about. And so when I started doing this work and this research almost 10 years ago now, really trying to understand the principle of resilience, I started looking at some of our literature from emergency preparedness and disaster response, because that's really where we have the most robust research with regard to community resilience as a concept. And out of that research emerged these 4 components that really help to inform what do we mean when we talk about community resilience. And so these 4 components here out of all of this really helped disaster like FEMA, CDC, Department of Homeland Security think about what were those factors that helped predict how well a community would bounce back after disaster. So those disasters were, think 9/11, think Hurricane Katrina, think about earthquakes, tornadoes, things of that nature. So acute shocks to a system, to a community. And so one of the components, the information and communication, how did information flow from agency to agency? What levels of collaboration were occurring there? The more collaborative city agencies were and various response agencies were, the better response they were, the quicker they could be in real time to respond to community needs. Community competence goes back to that rule and thinking about, we're all told in emergency preparedness, have 3 days of supplies. Be ready to be on your own for 3 days before the troops come in to save you. So really thinking about, and looking at how well was that community prepared for this particular response. Did they understand where the evacuation routes were, where the center of safety were, where to access resources? And then social capital is really looking at how well knit from a social perspective was that community. Did they check in on one another? Did they make sure that, if there were individuals that needed help in evacuation or needed help in response, that they were there for one another, that they were even aware of each other there, and there was a real strong sense of ownership of that community. And then the last piece that we forget quite a bit, particularly from a public health perspective, is looking at the level of economic development that was in that community. So what was it there? What was the engine that was driving the vitality prior to that disaster? So when you think about comparing Hurricane Katrina to, say, 9/11 in New York, well, New York had a number of different economic buffers to bounce back from. There's center of financial district, there's entertainment there, there's a robust network of small businesses. The boroughs themselves are quite, socially connected, quite a bit of cohesiveness there, as well as a global network that connects New York. So there should have been no doubt that a city like New York would bounce back. New Orleans had very little of any of those things, particularly around the economic development in one particular area. And so in the 9th Ward. And so when you think about, when you go back, and I was just in New Orleans earlier this summer, and you can see where areas of development have come back, but not necessarily the same people have come back. And then also in 9th Ward, nothing has come back. But nothing was really there to begin with. So you really begin to understand, I think there's a really good example of what are we putting in place so that we can bounce back from disaster, but from a public health perspective and from a prevention perspective, what are we putting in place, and how do we use these things to help individuals and help communities bounce forward? So that's really the essence of our work. So the how do we do this? So as I showed you, we're in 5 communities across the country, and there's a process that we apply. We help these communities apply to really get to building community resilience. So there's 4 simple components here, and I say simple in the sense of seems like it's pretty straightforward, but we're talking about systems change, so it can be messy. And many of our partners, have just said, say yes to the mess. Because what we're trying to do is really change systems, revolutionary change. And so you have to be ready to get a little messy. Don't wear your Sunday best to the meetings. But looking at shared understanding, so much like what I've done here in this talk, is really create this shared understanding. What is the problem that we're trying to solve? What is the adversity? What does adversity look like in our community? What are the number 1 priorities within our community, and how can we begin to work at this? And then the state of readiness is really like working from partner to partner What is our readiness? Where are the strengths that we can build upon? Not just looking at it from a deficit model, but what is it that we can build upon? And then as you go through that process, you'll recognize there are various gaps, whether that's in policy or practice or in program. And so that naturally you need to invite other cross-sector partners to be a part of this work. But what's most important, we're talking about community resilience. And so we're not just talking about systems crunching community data and then saying, hey, we've got this great plan. Don't you want to be a part of it? No, it's actually having community as a part of this system, building out that narrative, the co-creation and identification of priorities in order to inform that plan. And this is also looking at what is going to be the long-term sustainability of this. So the more cross-sector partners that we have involved across our sites, the bigger bet that we have for longer-term sustainability, but also the more and deeper engagement that we have community, the greater buy-in we have from community, so that we also are ensuring long-term sustainability through adoption of the practice and programs. So what do these practices and programs look like? Well, first off, I want to give you an idea of just understanding how the teams are approaching and applying this across the various sectors. So understanding here in Austin, I pulled some of these statistics that would help you think through, like, well, what's our starting point here? And so these data are from some of the national surveys that show that a large number of your families are already discussing their problems together. So we're seeing some level of family cohesiveness, that they're working together to solve problems, that they have the strengths, they feel like they have strengths to draw upon, and that they are hopeful in the face of stress. So this is really hopeful that individuals in their family units actually see some hope and can draw upon one another. So that shows that there is some level of social cohesion there. But when you come down to the community resilience framework, what are these various sectors doing to help support that? So it's not just about how you feel about your future, but what can you actually access to be more productive? And so working through with our county, with city governments and county governments, and thinking about how are we, the provision of community services, how is that aligned with actual needs? Understanding the quality of life, the access to affordable housing and quality health care, which is absolutely one of the, I would say, one of the needs here in the Austin area. And then using that process to really address these things on a systematic level. So, and let's get to the how we're doing this with some of our cities. So I want to start with Dallas, because obviously it's a sister city for you all. But I think it's also an interesting example, because Dallas, we worked with them directly, city government directly, in helping them develop their resilience strategy around one of their goals, and that was creating healthier communities. So it was helping them identify how do we engage with community, not just across systems, but engaging in community, to really inform what are the priorities with regard to health and the access to economic mobility and that intersection with health. So understanding that it's not just about educational attainment, but it's also about looking at our city infrastructure. Do individuals have an access to the areas where there's opportunity, economic opportunity, versus where they live? So again, when I showed you that earlier map where you had the east-west divide, the individuals are getting pushed further out east, yet the economic engines are even further away from them. Is there an easy connect via public transit? Really thinking across multiple sectors and how are we creating access, equitable access to everyone. And so Dallas's work, I think, is very informative for a number of different reasons, around how you engage community, but also how they'll measure success. So part of their resilience strategy is also adopting this equity framework. And part of the work that we do is helping communities and helping city leaders understand that you can't be a resilient community if you're not an equitable community. So it's using the resilience framework as really a means to achieve equity and understanding the traumas that are associated with inequity, with long-term inequity, because that's part of the systemic design. So in the city of Dallas, that's the work we'll be unveiling with them, the equity indicators, and really doing the kickoff with community partners and how we'll move the strategy forward in our meeting with them in October. But that's, bringing together a multidisciplinary group of community partners, Children's Health, the Community Council, City of Dallas, and a number of other partners there that are really driving this work. So this public-private partnership to do that. Similarly, we're doing work like this in DC, where we're working with the Office of Urban Resilience, again, thinking about a citywide strategy with regard to resilience and understanding not just resilience in the face of an acute shock, but that chronic adversity, that day-to-day adversity that would help us to inform a much stronger and resilient Washington, D.C. And again, looking at a multidisciplinary network of partners that can address not just the health and public health aspect of this, but also the community engagement, the urban planning piece of this. So we're thinking about all of the various parts that inform a city's strength. In Cincinnati, it's much more grassroots. There is some engagement with local public health, but it's a number of different organizations that have come together. Some of them were coalitions around childhood poverty. Others have been around substance abuse, social services, and human services that came together, figured out what are their intersections around resilience, around addressing ACEs, and doing more peer-to-peer engagement around parents and working from the grassroots level up to the systems level. In Oregon, it's actually a state-level network now. It started in the city, actually in Multnomah County, and it's now spread to a statewide network where they have a network of children's programs across the state, but they're also working at the state level with the Oregon Department of Health and Human Services, their child welfare program, as well as their public health entity. What I think is really interesting is what's happening in Oregon around this explicit statement around equity. Multnomah County Health Department recently adopted a vision statement that they will be undoing, their mission is to undo the effects of white supremacy. I really want to know how they're going to measure that. But I think it's really important that in order to solve the problem, they've chosen to be quite explicit on what it is that they're trying to tackle. And this is really interesting in a state that has a less than 5% population of African Americans and people of color, but understanding the pernicious effects of racism and discrimination for a state that was set up as a free white state. So it's literally in the state doctrine there. So understanding that they use our tools and assets for a number of different things of what they're trying to do, whether that's advocating for practice and policy change, building coalitions, developing partner building and communication strategies and such. And so all of our tools and resources are free and available on the website. There's also lessons learned from all 5 of our sites that can be applied in community to community to help individuals understand you don't have to wait for someone to tap you on the shoulder. You can start your resilience revolution yourself. So I want to close with some guiding principles that we have in BCR. So you heard me earlier talk about the universality of ACEs. And so one of the things that I didn't include because I had less than an hour to speak was this chart that we use to demonstrate who faces ACEs. And so the government data, the study data is there. It's pretty much equal exposure to adverse childhood experiences regardless of race, regardless of education level. But what's telling is that what's happening to individuals after they have their ACEs. And so that's where we see the disproportionate outcomes. So that we see and we know that we have chronic adversity based on individuals of color, based on gender even. And so that really begins to speak to these factors that are outside of the individual and really more about the community and more about the systems that we have in place. And so helping to normalize the conversation around ACEs so that people understand that they are universal, the exposure to ACEs are universal, but also being able to help them understand what was it that helped them bounce back and also bounce forward. And the differences in those buffers and supports that were available to some people and not necessarily available to all. That the pair of ACEs, that this is such an important framework to not just focus on the adversity that's happening to individuals, but the context in which this is occurring, so that we begin to understand not only are we talking about an individual experience, but we're talking about something that's happening at a systemic level. and that if we truly want to turn this around, that we have to begin to think about systems change. And that every sector has a role. As you saw in that pair of aces tree, which is on that handout, it begins to help you see school systems, public health, urban planning, environmental sciences. Everyone has a role in building community resilience. And that we don't look at this just merely from a deficit standpoint. We want to start with a strengths-based approach. And this is something that we've learned is really important, because when you start from a deficit model, people immediately think, particularly policymakers, how much is this going to cost me and where am I going to take the money away from? And so really we want to say, well, what are we doing well? How can we start there and how can we spread that rather than getting into competition with others? And then and that's where our work has really grown. And then this idea and understanding of the concept of what we're doing is creating buffers. We can't prevent all traumas. We can't prevent all adversities. But what we can control is how individuals are taken care of in the inevitable. Because unfortunately, some things are inevitable. Some things aren't. And it's our choice as to how an individual can bounce forward in those instances. So I would say to you tonight that you all have a role. Every organization that you work with has a role in building community resilience. And because you're here tonight, I would ask you to give yourself what we do in BCR is a standing ovation, because you are the start of a resilience revolution. So thank you, and stand and give yourself thank you. Do you have questions? I think it's on.
Hey everybody, my name is Mark Cruder. I'm with the Office of Sustainability, and we co-sponsored Wendy to come here and speak to you guys tonight. Thank you all for joining us. I'm going to do one quick question, and then I'm going to open up to the audience to ask questions and have Wendy respond. My question is pretty simple, but very complex. So I work for the city of Austin, and we're trying to sort of put our heads around what community resilience really means and how we start to engage in communities on this topic. But my question to you is, where do we start?
So I would say there are a number of places to start, but we always look at, am I on? Can you hear me? Yeah. Okay, all right. So one of the places to always start is, look at who's at the table already. And how can you make that connect? Are you making a purposeful and meaningful connect to community partners, to the community of which you want to serve? And if that gap is missing, if that community partner, if that community is not represented at the table, that's where you need to start. And so that's part of this process of discovery, is so that you can get to the point where you can begin to prioritize. But the first part of this work is really about trust and relationship building. And you can't do that authentically without having the community voice there. But also the trust, you're building trust across organizations. So if you can start with that circle of trust and then create the shared understanding within that circle of trust, what we've seen is this literally grows virally, because as you begin to engage individuals across sectors, across communities, that there really is an energy. It begins to just kind of grow out of your own control. But you have to start with that fundamental center of trust. And that's the hardest thing for us to do in systems, because we're talking about undoing systemic reasons for mistrust. Yeah.
Well, we're lucky to have well-respected organizations like GAVA in Austin that have those relationships already built, and it's for us to really step up to the plate and make those changes.
And I will say this too. One of the things that to really get down granular there as far as where to start. None of our systems, like I talked to you about Oregon, and we talked about the fact that it's a state level. In Dallas, it's now a citywide initiative, and they didn't start that way. In fact, in Dallas, they started at 3 zip codes, because that's where Children's Health had the most robust relationships. And then the partnership network grew, and then the city of Dallas took it on, which actually had the capacity to make this a citywide initiative. similar with Oregon, it was actually starting in one school, one public school. And then that, it's like the old, I'm dating myself, but some of you might know the old Brett commercial, and then they told someone, and then they told someone. So, I mean, it's really helping to understand how these types of movements begin, and that's what we're really talking about, is a movement for change. And so, but the difference is that we're not doing it from the outside in. It's really working both outside in, inside out, in order to have systemic change.
Are there any questions from the audience?
What are we trying to change? So that is dependent upon your community. So it's not significant. I mean, it's not specific, or we are prescriptive from community to community. In all of our communities, they come together with their partners and determine what are the things what are the elements of adversity that they want to change. So in Dallas, they really looked at inequity as being the driver, and then how does that express itself across multiple sectors? So thinking about that from an infrastructure perspective, thinking about it from healthcare, public health, education, and then who needs to be at the table in order to drive that change.
Yes.
You mentioned these ACEs, these stressors that accumulate over time. What are some ways to deal with them if we want to, I guess, educate at least our kids? What would be some ways to talk to young people about how stress accumulates?
Yeah, so I mean, there's plenty of therapeutic means by which that are available for. So in our particular market in Portland and in Cincinnati, what they've been doing are in implementation of trauma-informed practice, so that children begin to understand like the physical reactions to stress. Understanding, I don't know how many of you are familiar with like cognitive behavioral therapy, where you begin to understand, with the fists clenching, the jaws clenching, the racing of a heartbeat, have belabored breathing. Those types of things are physical cues that we're getting angered, or we're getting stressed, or we're being re-traumatized. And for children, that can be very unsettling, because they don't necessarily understand how their body's reacting to something, and certainly aren't in a position to control that. So that's really looking at things at the very micro level. And certainly, in the school systems, we've been quite effective in helping to spread trauma-informed practice, so that teachers and individuals within the school system understand and can recognize those signs and symptoms of stress. Yeah, absolutely. So we've had, so we've had in Oregon, they've actually gone in and using the behavioral health specialists from Trillium Family Services, which is one of their core partners. They went in and they trained the entire staff on trauma-informed practice. But it's not just about for the students, it's also for the staff. Because when we think about, a lot of our frontline staff, whether that's in schools or whether that's in daycare centers, they're also similarly living in the similar traumatic environments.
So are schools good terminals of engaging with
Absolutely.
people?
Yes. So in fact, that's where the work started in Portland, was in a public school. And they used that as a means to bring together a number of different partners into that work. And so they have Kaiser Permanente, Trillium Family Services, Pacific Foods, which is bringing in organic foods. I mean, it's really a holistic approach to thinking about not just the behavioral and mental health needs, but also the physical health needs of individuals and the social needs of individuals. And so it's really bringing together that multidisciplinary team that can address those needs. So people are doing what they're really good at, and not asking teachers to take on, a whole new therapeutic role while they're trying to teach, but giving them a tool that they can use to diffuse a situation in the classroom so that a child can be able to focus on learning. And I will say that the outcomes that we've been able to see in that has been a reduction in suspensions, a reduction in absenteeism, an increase in the reading levels, so this is important for schools, increase in performance levels, and also an increase in teacher retention. And this is the only public school in Portland Public Schools that's actually seen this kind of turnaround, this dramatic turnaround in a short amount of time.
So, Sabina, but I'm just going to say that I'm going to repeat the question after you say it.
You just touched a little bit on metrics. Can you talk a little bit about how your experience in different cities has helped you design data-informed, but perhaps not data-driven metrics that help a community that are specific to a situation? Like, how might Austin have
Like, how do we know, well, that's resilient, that's not resilient?
Yeah, so okay, go ahead.
Oh, so in discussing about metrics, how do we know if a community is resilient or not resilient, understanding what other cities have done around metrics?
So the first thing to do is come to a common understanding of what we mean by resilience. So what would be the expression of resilience for our particular community or our particular initiative? And so to go back to the Portland initiative, what they thought would be an expression of resilience were some of those indicators, those metrics that I described earlier, right? So thinking about student performance, because it's in a school. So we want to impact student performance. We also want to have an impact across health. We also want to think about, because they had a food partner, you know, how are we addressing food insecurity? There's also understanding that this was an area where they have really high levels of concentrated poverty. So while we're taking care of what's happening inside the school, well, how are we having impact in the community? So making sure that we had the right partners at the table to begin to address some of the issues with regard to affordable housing. But one of the things that I think is really important to think about when you think about resilience, why I talk about it like looking at an opportunity index, looking at access to economic mobility, is because we know this goes back to the science of resilience, both from a community perspective as well as from the family and individual perspective of, if we already know the metrics that indicate resilience at those levels, then all of we have performance measures from systems. How are we aligning all of our work so that if we've defined resilience up here as, say, we want to have more affordable housing, we want to have better performance in schools and things of that nature, that's going to inform how you'll know whether or not you're being resilient or you're achieving resilience in your city. It's not going to be one set dashboard that works in Austin that's also going to work in San Antonio. It really does have to reflect the priorities of the individuals in your community, but also the assets that you have at hand, if that's helpful. But that's how we work with the teams. It's not a one-size-fits-all. I don't know, Daniel also, our team, we also collect a number of different metrics that are outside of performance metrics to understand how partners are working together within that network and how that network is getting formed and the specific outputs that are associated with collaboration. So it's not just that we met, we had a great meeting, everyone slapped their hands, we had cupcakes and we all felt good. No, but it's like what is measurable that comes out of this collaboration? So that's also another indicator that we look at for resilience, because we know that if we already know from the literature that the way that agencies collaborated and aligned services absolutely informed how well a community bounced back. So that is also another indicator of resilience.
Yes, I recently read an article about the lack of social mobility in the last decade in the United States and how Canada is accelerating, and I was wondering if you could speak to what Canada is doing so much better than the United States is doing as far as equity and social mobility and resilience.
So
Question is,
yeah, go
you
ahead.
speak on Canada and their work around resilience and equity.
Yeah, so I won't call out Canada specifically, but I will compare the U.S. to some of the other OECD countries. So that's the Economic Council and Development. This is an international organization. And so when we look at U.S. compared to most developed countries, we actually do fall fairly low in the ranking. It's not just against Canada, but it's against most other countries. And one of the differences, the bigger differences, are balance of spending in the social arena versus in military spending. And so we disproportionately spend more money in military spending and in government spending than we do in social services. So when you think about things that are very simple, such as something like family leave, you know, we've had to fight very hard for family leave in this country. But we also understand that family leave is something that's very important, that time, that bonding time, not just for mother, but also for father as well. That bonding time with children is extremely important for family cohesion, but also, as I showed you, for the child development. And that is something that most developed countries, that's an automatic, that we have family leave there that's paid. So you look at where we're investing our money, and we're disproportionately not investing in those important areas that support growth. And so those things also inform the trajectory for individuals. So how well they're developed, how ready are they to learn to school, go to school. And then, you know, when we think about how we finance public education in our country, It's very different than other countries. And so that access to economic mobility, absolutely, a lot of it depends upon your ability to be able to access higher learning. And that's something that's increasingly harder for individuals in this country to do. So when you look at where we're spending our money, that's, again, our systems are designed for the outcomes that we see. And that, when you compare us to other countries, it's really clear to be able to see that difference. Mm-hmm.
My question relates and goes a little bit back to the basics and just focus on the word community. As comparing the U.S. to other countries, I feel that the U.S. has such a strong culture of individualism. And so defining community, what that means to you, and how to even start fostering that sentiment before you even talk about resilience, what your thoughts and opinions are on there and where you see community to be the strongest.
Mm-hmm.
How do you define community in a culture that's focused on individualism?
Right, and create that support at the most basic level to create resilience.
And
Yeah.
how does that create support for resilience?
So that's why I said at the very beginning, because what we're talking about is such massive systems change, it's usually easier if people can kind of pick an area to define for themselves, like how are we defining community? So as I mentioned, in Dallas, they started with 3 zip codes, and it was very easy for them to navigate that community and help create that community narrative. So what did community mean to them? And then that helped to also understand how we would tailor services in a response to priorities and needs. So I can't define that. It's not really important how I define community. It's important for those individuals that are doing the work to build their own community on how they define community. So it can be geographic, it can be cultural, it can be, it can be a sense of identity of some sort. But what's important is how that community, your partners that you're working with, when you say you're working on community resilience, number one, you have to fundamentally decide what is your community in order to then decide what is resilience going to look like for that community and what are the strengths and assets that you can bring to bear and begin to identify the gaps and needs in there. So, I mean, that's a way of answering the question for you, but again, I try not to be prescriptive with that because, there is no one model. There is no one. I'm in 5 different communities, and I'm in 5 different communities. There are commonalities and themes of working within systems, but the populations are going to vary, and our tactics have to vary with that.
So are you finding in these communities that cooperative models are one of the best fits for bringing in community input and creating, say, an economic engine that would drive towards like our Imagine Austin milestones that we would like to see?
Mm-hmm.
Is that like one of the best fits for a lot of the economic development to take at a certain scale?
Mm-hmm. Do you need to repeat?
Are cooperative models the best models to drive economic stimulation in certain communities? Did I capture that?
Yeah.
And particularly with respect to the Imagine Austin milestones.
All right.
Mm-hmm.
Specifically to our Imagine Austin, the comprehensive plan milestones. And I'm repeating this because it's getting videotaped and it doesn't capture your questions.
So one of the things that you heard me kind of allude to is I don't use these big terms. So, and if I do use them, I try to unpack them. And so cooperative is one of those terms that I try to stay away from because they can be, I know that you have in your mind what cooperative means, but I also know what cooperative means to me, and it may mean 4 different things to individuals in this room. So I'm, unfortunately, Mark, going to ask you to unpack cooperative so I understand and can answer your question on what you think is cooperative. Yeah.
Sure. So I'm thinking of worker-owned production cooperatives so that they can protect their jobs and their employment. And I'm thinking, for example, maybe teacher-owned education cooperatives, maybe a resident-owned cooperative housing for affordable housing, and of course consumer co-ops.
Go ahead.
So there are multiple types of different cooperatives, including housing cooperatives, you have economic cooperatives around purchasing, you have teachers cooperatives. Cooperatives essentially can come in a lot of different forms. but they're essentially a system in which a group of people come together and decide on one task. Is that correct?
Collectively owned.
Collectively
For
owned.
example,
Collectively owned.
Consumers can get some buying power
Yeah.
Right.
increased in the consumer co-ops.
Yeah.
And the workers can protect jobs
Mhm.
there, so that, I mean,
Right. So I'm going to relieve my
Yeah.
interpreter here because I think your hand signals are. But I think, you know, what you're talking about, no, it has not surfaced and is a larger part of the movement. And I think one of the reasons is because there is such a focus on the systems piece of this. And actually, when you think about cooperatives, that's creating a whole nother system within a system. And so it's not to say that that's not a good tactic, but because the focus has been really on re-engineering our systems and aligning our systems so that we can be more effective, so that if you did have a cooperative, would it thrive in the current environment, the way our systems operate? I'm not sure. I mean, I think that's part of the push and pull where we've seen some of the successes and some of the failures with co-ops is that they're still operating in this larger environment that's just pretty hostile to it. So until we get the systems more aligned so that communities could have operative co-ops that actually work in concert with our systems as opposed to something that was set up as to oppose or to protect from, then I don't know if that's necessarily a really good use of our efforts at this point. I will say with regard to, but it's important when you talk about the land-owned piece of this and how like tenant-owned properties and things of that nature, what we are seeing out of Oregon, which I think is really important, is thinking about that, creating that barrier and that buffer for individuals around gentrification. And so using tactics such as land trusts and cooperative agreements amongst owners to protect value so that individuals can stay in the homes that they own while some of the other development goes on. And while while that development's going on, it's not just for the new residents, but that those that have been there for a while can also enjoy the beautification and the improvements that are happening in that zip code. So that's one area where I am seeing sort of this cooperative and creative agreement being made amongst individuals who actually have ownership in community, but not something that's coming out that's wholesale, like trying to start something new within a system within systems. That's not to say it can't happen, but I think that we want to make sure that it's not an either or, that if we're doing it in concert with one another so that it's an and.
So kind of going back a little, not a lot, talking more towards the, like, I guess, geographical location part. I like everything you say. The part that I'm having a really hard time like, kind of seeing where it goes, just because maybe the three different community styles. But we talk about buy-in from the people that live in, whether it's a zip code or whether it's community. We're using different entities to kind of drive that, whether it's city government, grassroots organizations, right? So where I'm kind of hung up is on that buy-in. So do you need to establish, a baseline between all the organizations that are operating, and how does that work from your end? Because I mean, I've worked on cross-functional organizations before, and finding buy-in is hard, right? I mean, you're working with LGBT organizations that do not have the same end goals as, food scarcity organizations.
Right.
They all have a place in what you're saying.
Right.
Here. And so I don't know, maybe you can kind of backtrack and talk a little bit about how you establish that in each area or where
Yeah.
you take that.
So I'm going to summarize your question, and it was a very good question with regard to how do you manage the mess. But understanding you're bringing in a number of different organizations, some of them have competing interests, and that's something that I didn't talk about, but I think it's important for us to think about, particularly when you're talking about working with a number of different nonprofit organizations that may be targeting the same foundations, maybe competing for the same grants, but also city agencies that are fighting for their budget dollars. And everyone's going in every year and making sure that they get their amount of money. And remember, it's a finite pool of resources. So if one sector is asking for more money to do something, well, that means that money's coming from someplace else. So how do you say yes to that mess, and how do you navigate that mess was your question. So what we do is we always go back to the principle of what gets measured is what gets done. And so we start with performance measures. We start with looking at organizational goals. We start at what are you actually funded to do? So at the end of the day, what keeps the lights on for you? So it's just like if someone told me I couldn't eat unless I read a book by the end of the month, you better believe I'm going to read that book by the end of the month. So I mean, it's really getting down to those brass tacks and really understanding what is the driver for each one of these entities and where do those things intersect. So remember I talked about 3 to Ph.D. Well, the public schools, working with a Lutheran university, separation of church and state in Oregon of all places, it actually happened because there was some interest there, mutual interest there that hit both of their professional performance measurements. And that's what actually got Portland Public Schools involved when they recognized that having this support from this outside entity, even though it was a secular entity, could help them get closer to their performance goals. And so that's where we actually start, is understanding once you've decided who's going to be at the table, you know, it's just like a report card. But, you know, understanding success is going to look like, it's going to look different from agency to agency. But if you can see where there's mutual success in here, that if I collaborate with so-and-so here, that's going to help me hit my performance goal, boom, there you are. And that also helps to build the trust. And it also helps to build this opportunity to share information, real and meaningful data sharing also across agencies. So, I mean, it may sound crass, but we have to be very practical when we're talking about working in an area where everyone has finite resources and also has to protect their resources to a certain extent. Any other questions? Yes.
With some of the organizations, have any of them moved on to like a higher advocacy level, like taking it to the court systems?
Yeah. So the question here was, with any of the organizations, have they moved on to the higher level? So have we moved on to big P policy? So yes, so our organization, so there are 3 Ps in BCR: practice, program, and policy. And so we have been working now with these communities for about 3.5 years, and along that we've also been collecting data, performance data, across the entities to understand how their collaborations have resulted in particular programs and practice change, but also how that can inform policy. So we work, because we're located at George Washington University in Washington, D.C., we have ready access to federal lawmakers, so we've been able to be involved and take the lessons learned from across the country with regard to collaboration around trauma-informed practice, particularly in response to the opioid crisis, taking some of the lessons learned from across the country and helping them to inform some of the trauma legislation. We actually, one of our big wins was getting the first definition of adverse childhood experiences embedded in legislation. That was 2 years ago with the Faster Cures initiative, and that was money that was set aside specifically to provide training in dealing with trauma around adverse childhood experiences. So that was a big win. So, you know, especially when 10 years ago, you talk about ACEs and they're like, I don't play cards. What are you talking about? So you know, that's where we've been able to have impact at the federal level, but also at the local level. We were doing quite a bit of work now across different partners in DC in particular, where they have informed legislation that has risen the minimum wage for early childhood education providers, has also instituted an education requirement that is then subsidized by the city, because we wanted to make sure this is our most vulnerable population, the individuals that are providing care for them. Not only should we be licensed, but they themselves should have an access to education and also have a secured minimum, a living wage. And so understanding that cycle of trauma we have to invest in order to break that. And so working with lawmakers to do that. In addition, again, around our work around ACEs and understanding and breaking the cycle of trauma is helping various city agencies recognize the importance of actually using the trauma lens with regard to resilience and understanding if you're going to build resilience, you have to be trauma informed. And so earlier this month, there was a council member brought forth a motion to develop an ACEs task force in District of Columbia. And so that was direct result of us doing some education work with council members in the city and across various sectors. So not just thinking about it from a public health perspective, but talking to juvenile justice providers, to talk to individuals that were in healthcare, to talk to educators, so that when this was brought forth, one of our big wins was, You saw that Paravasis tree. Our Attorney General actually entered into testimony our Paravasis tree as he was talking about why it's so important to think about adverse childhood experiences in the context of adverse community environments and how we have to address these issues if we're going to have a resilient DC. So those are some of the big policy wins and with regard to how you begin to move the needle. And again, it starts with that. It's hard, it's sometimes tough, but you have to start with the relationship building and the building of trust and demonstration of value of the work that we're doing. So that's one of the most important, I think, elements that we bring to the work is helping our teams demonstrate the value so they can be effective in front of policymakers and inform that practice and that long-term practice and policy change. Any other? Yes, in the back.
I'm wondering about, you know, the people that are involved in your model want to be there, they have mutual interests, and I think it's a brilliant model. I also think that the world or the environment that we're in right now is downright hostile to stuff like that.
Mm-hmm.
And I'm just wondering about talking to ordinary mortals, you know, like your neighbors and other people that you come across, so that people are actually elected into office
Mm-hmm.
who would just adopt stuff like this without, you know, they would represent their constituents,
Right.
which is who would want something like this to happen.
Right.
And so I'm just wondering, like,
Mhm.
what do you say to people who are either clueless or hostile?
Mm-hmm. So this is why so let me restate the question. What do I do? How do we, particularly in this given political climate of hostility, of division, I would say, particularly division that has a very racial tone to it, where equity could be something like, oh, you know. How do you deal with that? And again, it's all about language. So it's not, you know, it's not that we're misrepresenting what we're doing, but we're looking at where's their common interest. And so one of the things that has really been helpful, particularly working on Capitol Hill, is coming back to this center of child welfare. And so really using that as our starting point. And I will also say that talking about ACEs helps. There are very few lawmakers that cannot recognize childhood trauma. Many of them say, that I've spoken to, said, why hasn't anyone talked to me about this before? In fact, I grew up in Cincinnati, Ohio, and there was an individual, David Mann, who was the mayor when I was in high school. And he was vice mayor a few years ago. He's one of those lifers in city government. And when we went back to Cincinnati to do a convening there, and I stood up and I started talking about adversity, childhood adversity, he came up to me, he says, why hasn't anyone put it to me like this before? I hear about poverty. I can't solve poverty, but I understand this trauma that you describe. And so that's what I was talking about, the language, unpacking these things that we talk about, these big, really threatening things. We can't expect a lawmaker to say, take on a poverty initiative and say, I'm going to have something that's going to be measurable as far as change is concerned within their election cycle. But we can unpack that and begin to think about those specific indicators that are going to resonate across all lines, that are improving across all of the community, that help to sort of diffuse some of that concern and that pushback. So that's how we've done this, is that while we know that equity means that there are some that we're going to have to spend more time and more resources on, we are really talking about something that is truly an American issue here, and that piece of it, and I think it because of the current climate, that's why we're seeing such growth in very deep red states. We're in Ohio, we're in Missouri of all places. I mean, and that's where it's a statewide initiative now, and where we're going into working with those legislators, and they're listening, they're receptive. So we have a rule and a couple of maxims that we use in BCR. No story without data, no data without stories. Lawmakers love stories, but their staff wants the data. So making sure that we are arming our teams with that information, but also describe, don't label. So it's a little bit of a nuance there, but when you're talking to individuals at the state and local level, it's so important to unpack these big concepts, so they can begin to see themselves in the work and begin to see a broader audience that we can reach.
What do you see happening 10 years from now with our country and on this issue? Do you have hope?
Oh, I have absolute hope. I wouldn't be here if I didn't have hope. To be honest with you, and this is why I started with the policy timeline, because if you really take the larger lens and looking at this, this is our cycle. We swing back and forth. We swing back and forth. And we're in one of these really extreme cycles where some would argue that with the Obama, we went to the left, and then, okay, this is my left, and then with this current cycle, we're going far to the right. And then what happened last time we wound up right back in the middle. And that's the American cycle. And so that's how I get out of bed every day. I'm a student of history. And so I tell people all the time, I said, we've been here before. We've seen this before. This is nothing new. Yes, the tenor is very, very harsh. And some of the tactics that we've seen are very extreme. But guess what? We've been here before. And if you study your history, you'll see that. And so I think that that's what gets me out of bed every day. It's like, this is not a time for me to cower. There's no crying in politics. There's no crying in this work. You get up, you dust it off, and you keep it moving. So I absolutely have hope. It may not in 10 years from now. You know, I hope that I'm still doing this work. I hope I'm still around. But I also hope that we have come to this realization that we're better in the middle than we are at the extremes. And this is actually an attempt to bring people that can't see that middle to help them find that middle ground so that we can have more productive work in our communities.
And what is your call to action for us to do right now?
So my call to action for you is, did you see yourself? Did you see a role for yourself in this work? And then contact Mark. No, I mean, you don't need a movement. Movement starts with the lone nut. So I don't know how many of you, when you go home tonight, you go on YouTube and Google search for the lone nut video. And so when I started doing this work 6 years ago, I was a lone nut. Because everyone that I talked to was like, oh my God, Wendy, this is too big. Because you just pick like one piece of this to work on. And I said, well, that's the problem. We've been working in silos, and we've been picking one piece of this, and we just keep going down the drain. If we want to truly take on change, we have to be that change. We have to be that change agent. Don't wait for the revolution to come to you. You start it yourself. And we all have that ability to do that. And so that's what I did. And then you cease to be a lone nut when you have your first follower. And then when you have your second follower, then you have a believer. And then the third follower, and before you know it, you have a movement. And look at this. 5 years later, we have a movement. So I would say that each one of you in this room, you may feel like the lone nut, but it only takes one person to help you start the movement. And all of us have that ability. So thank you. I want to thank the Office of Sustainability. I want to thank Imagine Austin for inviting me here. And like I said, I really want to thank you tonight for being in this room and doing all that you do to imagine Austin.